Thank you for attending this webinar about problem-solving justice or court. We can say both, so you choose. So although you prefer court or justice, the problem court or justice is to judge elsewhere and to judge differently. And I will first present a short definition of what is problem-solving court in France, and then I explain how probation works in France and how it deals with this program of problem-solving court. And in the end, I will present you the concrete example, as our colleagues have just said, a concrete example of how this program was handled and is handled in the probation service of La Meuse, who has received the Hall Award from the CEP in 2025, what you just said. And maybe you should acknowledge that attending this webinar is Gaëlle Collin, the director of the probation service of La Meuse. And it's a real honor since it's the first time French probation service received this distinction. Under the leadership of Gaëlle and her team, La Meuse developed a problem-solving, community-anchored approach that operationalizes the principles of dynamic supervision in a concrete and human-centered way. Their program of problem-solved court integrates structured assessment tools, collaborative case conferences, and rapid response support pathway, ensuring that individuals received tailored interventions the moment acute needs emerge. What distinguishes La Meuse is not only the methodological rigor, but a culture of proximity. Probation officers work closely with local partners, families, municipalities to stabilize housing, employment, and health situation before they escalate into breaches or reoffending. The CEP jury highlighted the team's creativity, ethical commitment, and capacity to translate probation values into daily practice, demonstrating how a small jurisdiction can become a European reference point for innovation and dignity in supervision and support of our public. We are really, truly grateful for the SPIP of La Meuse to have won this award and really proud of her. Thank you. So this webinar is to present the objectives of the program, the implementation in practice, how we build it, and practical experiences, the challenges, the successes, the lessons learned, the difficulties, and how this program fits into the broader criminal justice strategy in France. So, what is the problem-solving court? It was initiated in Miami in the 80s to address the devastation caused by crack cocaine and the ineffectiveness of traditional justice. The authorities collaborated with other services to create a system targeting both the causes and the consequences of the phenomenon: health, social, family issues. Today, this model has spread widely. There are specialized programs, mostly drug courts, and it has been adopted in many countries. In France, actually, there are currently 6 services above 103, and 7 starting to integrate these programs. A census investigation will be done in 2026, and we also know that about 30 courts are involved without the probation services also on problem-solving court. Studies show its effectiveness. A 14% improvement compared to traditional approaches, thanks to the reduction of offenses and health problems. It aims to reduce reoffending by combining judicial supervision and social support. It's a holistic approach, such as access to treatment, housing assistance, social help, education, and employment service to promote professional integration. As we said, traditional justice until before the problem-solving court failed. So it's another way to approach the support of offenders. The goal is to help the offenders overcome issues that contribute to their criminal behavior and to promote long-term reintegration and community safety. This model places the individual under judicial supervision at the center of a multidisciplinary, motivated, and collaborative support process, overseen by a judge. That's why we talk about judicial supervision. Based on the motivational interviewing and RNR, risk, needs, responsivity, and the Good Lives model, based on a person-centered framework for offenders' rehabilitation. Rather than focusing solely on risks and deficits, the Good Lives model emphasizes the development of personal capacities, resources, and opportunities, enabling individuals to pursue primary human goods, such as autonomy, relationships, purpose, well-being, in ways that are compatible with the public safety. So the problem-solving courts are based on 10 guiding principles. It has to be under the supervision or overseen by a judge, as I said. This means that the judge has to have a regular presence. The magistrate is involved in the system, is essential. I mean, he's the key of what we are going to feedback to the person. This backing implies a change in the posture of the judge, who becomes an actor in the support. Second principle, thank you. When we talk, and also another condition is to have a fair and public judicial court. It means that every time the person involved in the PSC, the audience, the court must be public. That means that everybody can open the door of the tribunal and attend this court. And as we say, this audience is also has to take place in a neutral place. It means that it's not at the probation service, it's not in the tribunal, but in a somewhere else, in a neutral place. And there will be the judge, but also all the partners involved in the process. Third condition, the professionals, we talk about specialization because the workers, judge, social workers, partners, health personnel, must be specialized professionals who have to be trained in motivational interviewing, as I said before, criminology, addiction, and traumatology. For example, a judge will be specialized in criminology, but maybe not in addiction. So everybody comes with his own knowledge, and they all have to have the same level of training. So when we talk about specialization, we'll talk about the same level of training for everyone that supports the person involved in the program. Fourth, please. The approach has to be problem solving. The object is to solve the problem, not to say your problem is addiction, but how all this group, all the professionals are going to solve the problem that makes that person be an offender. The support must be so logically for this individual and not general. It has to be global for him and co-constructed with him. So it means that the person has to be a volunteer, has to understand what it means to be in that program. Je parle pas fort?
C'est ça.
It's a question of defining concrete objectives, objective that the person can reach, not telling, for example, for addiction, tell him to stop his addiction, but just to how to slow down, for example, and to have two goals that he can achieve, not goals unachievable.
Realistic.
It has to be then adapted to the situation of the offender and of mobilizing the resources necessary to achieve them. Next one, please. As we say, we talked about the fair and public justice court, and this court, his objective is also to pronounce and to communicate with the person for intermediate sanctions and rewards. It means that these meetings where the person comes and we give him a feedback, this feedback can be negative, but can be also positive. And we see that, for example, we talked about the judge that can be seen as only a person that gives sanctions. And then in this problem-solving approach, the judge can give rewards. It means that he can congratulate the person for that he has done this or that. And it's very different for the judge and for the person to have all a group of people that support him, tell him that what he's doing is good and that he's doing great. So it's to underline, know the progresses and also the difficulties that the person meets and try to find solutions together to solve, again, the difficulties he's still facing. Next one, please. As I said before too, where they meet should be a neutral place. It means that the person has to have all the response to the needs he has on a single window, one service point. It means that all the partners, social, health, employment, housing, judge, meet at the same place, but the person has to identify a unique place to go and to find all the partners that can respond to his needs. That's why we talk about a single window and one single service point for the person not to go on different places that we know that people who are very fragile would do one step, but then the other, the second day would be too hard for him for her to go and to again explain his situation. There, other partners know about him and can help him really responding to his needs that everybody knows. Next one, please. One rich part of this partnership is that, as we said before, all the partners work together. And it's a partnership-based work. It's an advantage, but it is also very difficult because we all have different cultures, professional cultures, a way to talk to the person or to support the person differently. And we have to all be on the same line. And this is what it's a very good thing, but it's very hard for people because everybody has to make a step towards the professional culture of others. So the system must be based on collaboration between the judge, probation services, health sector, and other associations in order to meet needs if necessary. The aim is to ensure close cooperation between judge, probation, and health professionals. Regular exchanges must be organized in compliance with professional secrecy and with the consent of the person. As we said, the single window, the person knows that everybody, all the partners have the same knowledge of his situation and share it. So he has to be okay with it and consent about that. That ensure the consistency of judicial and health decisions that the group, the supporters are going to take for him and to suggest. Next one, please. Ça. C'est tout?
Les 25, bien sûr.
Mais non, ça, on l'a commencé tard. Okay. The justice system is integrated in the local community. It's not only justice, but also partners for any citizen. Regular next one, please. The problem-solving approach has a link with the health, as we said, because it's for drug users. So in the program, they have to accept that they will have regular drug testing. Next one, please. And we talked about rewards before, but there's also something very important. Sorry, we have low battery. So at the end of the program, it's important to have rituals for like graduation ceremony, formal encouragement court, symbolic or structuring device to mark the stages of the progress and get a positive feedback. And in France, we have examples of courts who give like a diploma to the person, or have like a little party. It's a strong word, but I don't know, everybody comes with a cake or something to drink, and they have like a moment to close the problem-solving court and tell the person that what he has done, he achieved it. And this is not in the justice culture. So this is very particular to the problem-solving court. Slide 3, please. So this is a French administration, penitentiary administration. It's the map of France, and on the left you can see overseas territories. This is how we are organized. So I'm going to tell you about French probation services, who are a key component of French criminal justice system, and they operate under the Ministry of Justice in France and are responsible for supporting individuals serving sentences, whether in prison or in the community. In France, offenders in prison or in the community are supported by the probation service. The link inside, outside is supported by the same service. Their goal is to prevent reoffending. Currently, the French probation, as I said before, are 103 in France, nationwide, including the Caribbean and Pacific territories. The number of inmates in France are currently very high and has reached more than 86,000 prisoners today for 65,000 places. So we are very high. bringing the prison to density to 135% for all prisons in France today. In the community, the French probation services support about 170,000 people. So we can say that probation services in France support about 250,000 people, 250,000 individuals. The probation services develop offender management programs, including problem-solving courts. These programs have been handled with different methods, goals, and contents in several probation services. The effectiveness of this approach is supported by extensive scientific research. In France, the first pilot programs were launched in 2015, and it's still effective today. It's at the initiative of MILDECA, which is an interministerial mission for combat drugs and addictive behaviors, French government body, who is responsible for coordinating public policies aimed at preventing and reducing drug use and addictive behaviors, and the National School of Judiciary, ENM in France, with adaptation to the national judicial context. Thanks to the leadership of the National School of Judiciary and financial support from MILDECA, more than 30 programs have been identified. An interministerial working group bringing together the Ministries of Justice, Health, and Prevention, as well as MILDECA, was established to identify, access, and structure these initiatives. In April 2022, a call for project was launched to evaluate the French pilot programs, identify those who inspired by the problem-solving court model, analyze between 3 or 5 of them, and formulate best practices and recommendations. Some of you might know her, Martine Herzog-Evans. According to the national survey conducted by the Probation Department in 2023, published in December 2024, 6 probation services have implemented an active program, and 7 were starting it.
Yes. Yes.
So we saw the 10 principles that I've said before. So the evaluation of Martine Herzog-Evans was to show how these 10 skills were managed in the services. Because the aim, and I will tell you that on my conclusion, is to try to have a public problem-solving court à la française, like French, because the 10 skills don't correspond exactly to French justice and probation culture, but we can talk about that after if you want to discuss about this point. Showing you that this program fits perfectly into the broader criminal justice strategy as it participates to reducing reoffending and to sending people in prison. A roadmap and framework between health and justice encourages also cooperation between justice and addiction actors. That's the point that shows you that it's really into the broader criminal justice strategy today. Then we are going to focus on what Meuse has done. So if you can just push enter, there we go. So this is the service of Gaël Collin, who's attending this webinar. So you can see where is it. It's near Luxembourg, Germany, Belgium, at the northeast of France. I will be their spokesperson. I will present one of, as I said, several initiatives implemented in France, and this program has shown boldness, perseverance, and above all, deep empathy toward the people we support. Their goal is to build bridges where there are often only walls. It brings humanity to the heart of justice. By the way, Gaël Collin might want to complete if necessary. So, Gaël, n'hésite pas à compléter si ma présentation est incomplète à tes yeux. The team in Verdun is composed of 6 probation agents and 1 director. Since the beginning of the program in January 2024, 31 people have entered the scheme, more or less long. 16 people in 24 and 15 in 25. 17 left the program during these 2 years. 4 for measurement purposes awaiting graduation. 3 went back to prison. 1 went in another place in France, and 2 deceased. 7 didn't comply with the obligation. 1 had difficulty for moving, and some had really hard psychiatric problems, and 5 of them didn't justify their absences, to be absent, to be
Sure.
they missed
The session.
the session. How did they start to think about another judicial proposal for that public? As you can see, and as I told you, Verdun is near many frontiers and other countries, and therefore it's a city where heroin is easy to buy. Facing reoffending of drug users, the probation services started to build another way of acting towards this public. The assessment is that consumers face precarious and complex economy and professional situation, requiring the involvement of multiple practitioners in addition to healthcare professionals. Moreover, to finance their consumption, they resort to criminal acts and often find themselves under judicial supervision. Social cohesion and public safety are too heavily impacted. All the health and justice stakeholders observe a sharp increase in drug use in the Meuse area, and particularly high in prevalence of heroin, as we said, because of the geographic place of Verdun. To build this program, the service had to pass by different previous steps, consulting different partners likely to integrate the program, search of funding to meet needs, funds to pay the coordinator, who is a nurse, and the Mildeka, as we talked about it before, said okay and gave the fund. Finding places to welcome the users, a unique place where the offender meets everybody, every partner, and finds with the coordinator, the caregiver, as you can say. Once all that is done, the probation service had to write tools to communicate with the different partners identified to join the program, like rules of the procedure to integrate the program, rules of the sentence plan, confidentiality requirements and limits, as we talked about professional secrecy, how to share the information about the person. And the program is implemented locally. Its focus on drug addiction and rehabilitation is really highly relevant to our public all over this territory. Consumers present precarious and complex socio-economic and professional situations. So many professionals can therefore gravitate around the same situation. Thus, a consumer convicted by the courts will be supported by a judge responsible for the execution of the sentence, who will mandate the probation service, which in turn will refer this person placed under the control of the justice system according to obligations related to the sentence. The problems are identified, but these professionals are not linked if you don't have a problem-solving court. It can lead to loss of information, and as we know, our public can say, he told me this, he told me that, and it's wrong, and he didn't understand well, and he will interpret or lie or use because it's not good for him to say that the probation agent told him this and the healthcare told him something else. So this permits to have all the same level of knowledge, and the person is on a trust relation. This referencing system leads to the person to have the honor to honor multiple appointments in different geographical locations. That's what I told you. That's why they had to find a place where the person could meet every partner, especially in rural area where little transport service exists. In the current system, the judge in charge of the measure mainly has the information relayed to him by the probation service and does not meet the person, except where there is an incident. The working alliance is therefore difficult to build. I've already said that. Many benefits come from this problem-solving jurisdiction for both offenders and patient and society, because the humanist philosophy avoids recidivism, reoffending, and even more desocialization, incarceration. Effectively takes care of addiction and related problems, and evolves professional practices towards collaborative work focused on the evolution of the person, placed under the control of justice by motivational approach, pragmatic and rehabilitating approach. The assets of this support were a unique place to go and meet every professional who supports the program, joint training for health and justice professional, working with the person in a positive relation, because faith, truth, and confidence are the key of the relation between everyone. And that is very effective in the probation and court program in La Meuse. How the probation service of Verdun selected the persons. The first condition was obviously to be drug users. Drug users and offenders are convicted often many times, and other solutions tried before have not worked. So the identification selection of the public is carried out by a care and justice professionals on the basis of a common list, and the evaluations carried out and the agreements or not of the people who will be met by these professionals to have the program explained and the contract of commitment signed. The public is selected by a twofold initial assessment based on validated tools: a criminological assessment to the risk of reoffending and addiction assessments. Only high or medium risks are selected to join the program. During the program, the evaluation is contents, since the actors concerned by the situation meets at every sustained pace to assess needs and prioritize actions. At the end of the judicial measure, criminological and analogical evaluations are also carried out. An evaluation of the program is planned by Drahor. Maybe we can go to next year. Thank you. An evaluation of the program is planned by Drahor. It is a tool that is called Dynamic Risk Assessment for Offenders Reentry, DRAOR. It's a dynamic risk assessment tool for recidivism. It was developed in New Zealand, and it is now used in several countries, including in the probation. It makes it possible to take into account what is changing in the person's life. This is particularly useful for adapting the support to the needs, often during the probation supervision. And now we are going to point what were the difficulties faced by the team building the problem-solving court. The main difficulties encountered in implementing this problem-solving court scheme were communication issues, how to communicate to get with the partners, the judge, the court, the team, the probation team, the shared governance, as we said, the training gaps between every partner, funding who could be insecure because we have to pay for a person that coordinates the communication and in Verdun, Gaëlle Collin explained to me that the coordinator, who's a nurse, goes with the person to meet, to make meetings, or when he has to go to any service to make some, comment on dit, des démarches, skills or whatever. He has to be he won't go if he was alone, and then this nurse is really the center of the coordination of also between the partners and the user, but also she's there for the user when his needs are really deep. And when you have insecure funding, it's complicated to imagine that next year you will be able to continue on that program. So that's a difficulty. And the need for an academic evaluation to assess the intervention, both with the regard to the user and the impact of this program, but also the relationship and the cooperation between the various partners. So this is still a need, but they are targeting to have one. So I'm almost finished. I'm going just to tell you what's next now for us, for France, about problem-solving courts. As I told you at the beginning of my presentation, the next step for us is to define a framework with minimum criteria standards for establishing a problem-solving court scheme with judicial courts and probation services that wish to implement it. Indeed, the 10 skills that define it is not totally adapted to the French judiciary system. We are currently working on defining a French style, as not all the criteria identified can be transposed to the French judicial system in order to enable as many services as possible to implement them. But we are all convinced that it's a real good solution and that we have to try another way of supporting some of our offenders. Teams need training in addictology, criminology, traumatology, motivation interviewing training. All the partners don't have the same level of knowledge on these items, and raise awareness for the inmates too, as the programs are mostly developed in the community. The point is also to prepare release from prison. Drug users are very fragile when they're released. Assessing incarcerated inmates is in planning their return to the society, including administrative steps, social support, reintegration, is also now an objective to reduce reoffending. And also, there's a reflection to extend it to other crimes, not only drug users, but also maybe people who have violent behaviors. Thank you for your attention. I hope it was clear.
Thank you, Marina. Thank you, Daniel, for your background help. It was a wonderful presentation, and you shared a valuable piece of work with us. Since we are a bit behind the time, we have a question that I will address immediately from beyond our participants. And yeah, I will save my question for later. But the question that we have comes from the colleague who is actually a member of our expert group on mental health, who is not only congratulating you on the award, but she would like to know whether there are guidelines for intermediate sanctions and awards for decision makers to have objective decision. And if she asked if it's linked to the dynamic risk assessment tool.
I'd like to have there are guidelines for intermediate sections. No, there are no guidelines for intermediate sanctions. It depends on the sanction that the person is going through. For example, if the person has a electronic device, the judge can take off some days, and the person will have to do more days on the electronic device. The judge can say that, for example, he can make it longer if the sanction in the community has to last, I don't know, 1 year. He can say, I put you 6 months more because you need more time. It's a sanction, but it can help you also to have the support of the probation service and of the criminal court, the problem-solving court to achieve the goals we have defined together. So it's very individualized, and in France, the principle is to individualize sanctions. So there are not guidelines exactly. And the other thing, is it linked to the dynamic? No, the dynamic risk assessment tool is really to evaluate if the person belongs to the program or not.
Thank you. I hope this clarified the question. Maybe Marina, can you elaborate also about the award, because you mentioned the electronic monitoring and, let's say, more time served on the electronic monitoring, but the award, is it that it can also go down the number of the days on electronic monitoring as an award?
Definitely, but the problem-solving court is not supposed to if the person is volunteer to integrate it. It's difficult to say that if he does it well, he will have a judicial reward. The reward is more moral, is more like you know, our public is not used to have moral rewards. Say what you've done is really good. The job you're doing is really good. Nobody tells that to them. And this reward is just enough. Because if they know that if they participate and then have less sanction, or their sanction will be shorter, then the relation is not really trustful. You understand? I hope I'm clear.
Thank you for this clarification. Let me check. There is one more. Could you give some examples for the
Not
meeting?
natural. I'm sorry, I explained myself bad. It's neutral. 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 It
Yes.
means that it's not a place where the person is linked or with health and is treatment or the justice. It's like in France, we have what we call Maison des Associations. It's like in the cities where the
partners, third party.
all partners can
They come at once, they meet. They come at once, they all.
Yeah, they come at once all together, but it's like comment on dit une mairie? Alcaldía, la española, ayúdame, la alcaldía.
Like a hall, municipality, a hall.
City hall. In the city hall, the city hall can make available a place where all associations, partners, even if it's not for our public, but for all citizens, have like half day, they're there for everyone. And the city hall makes it available for the public court justice.
Thank you for this explanation. Before we close, one last question from me. Is there one key element in your view that makes this program work? I mean, you mentioned that you started piloting in 2015. So, what in your eyes makes it work? Is it the communication smoothness? Is it the team? That's a question from me. It's not in the chat.
Oh, it's not in the chat.
Oh, I'm sorry, I was
From
reading.
me.
Can you?
It's from me. Before we close
What
down,
what
whether there
what
is
what
one key
is?
element in your eyes, one key element that makes this program work? What's the crucial? Is it the
The
communication,
holistic approach.
the holistic approach? Thank
The
you.
fact that we all have the same level of information, of training, and we all talk together about this one person, and when the person doesn't have like 10 persons to see, but a group. And this holistic point of view is very helpful for the person.
Thank you, Marina. Thank you, Marina, for answering and for the presenting this program on behalf of the Meuse Probation Service of the Verdun district.